A 64-year-old woman comes to the hospital due to sudden onset right arm weakness and difficulty speaking, which completely resolved in 20 minutes. The patient has had no shaking movements, headache, nausea, photophobia, or anxiety. She has a history of hypertension and hypercholesterolemia and takes amlodipine. First drug, calcium channel blocker dihydropyridine, and rosuvastatin, another important drug, beta hydroxy beta methyl glutaryl coenzyme A inhibitor, coenzyme A reductase inhibitor, which is a rate limiting step in cholesterol synthesis. Her blood pressure is normal now and pulse is 78 fine, neurological examination unremarkable, finger stick glucose normal, ECG shows normal limits, carotid Doppler level reveals mild left common carotid artery stenosis. These are the important things you need to mark in a question stem of USMLE or NEET PG, because NEET PG is going to be USMLE style. Now you have next. NEET PG, NEET PG will be there, but next is for MBBS students. So in next exam, you will get these clinical features. MRI of the brain and echocardiogram are unremarkable. Now be prepared for these questions in your next and NEET PG exams and USMLE. If the patient is started on an additional medication indicated for her condition, which of the following adverse effects is most likely to occur? Now first things first, I told you don't jump to the options. First, we will try to understand what the patient is having. The patient has hypertension, hypercholesterolemia, and sudden onset neurological deficits, that is right arm weakness, difficulty speaking, that fully resolved within minutes. Most likely the patient had a transient ischemic attack. In addition to optimal blood pressure control, which we are doing with amlodipine and statin therapy, low dose aspirin is commonly used to prevent ischemic stroke in patients with transient ischemic attacks. How does it work? It is an irreversible COX inhibitor. It irreversibly acetylates the enzyme COX. COX-1 is present inside platelets. So what happens, all of you know, aspirin is nothing but acetyl salicylic acid, right? So this acetyl group, this goes and binds to COX-1, the acetyl group. Salicylic acid remains unharmed, nothing happens to it. Fine. You can be asked in your exam which part of the aspirin inhibits COX-1 acetyl group. It inhibits COX-1 preventing platelet synthesis of thromboxane A2. You know, there is, just like we have sympathetic parasympathetic, similarly we have thromboxane A2 and PGI2. Thromboxane A2 causes platelets aggregation and PGI2 causes platelets inhibition. Fine. PGI2 is secreted by the vascular endothelium via the enzyme COX-2. And thromboxane A2 is secreted by platelets by the enzyme COX-1. So aspirin basically targets this. But at higher doses, aspirin can inhibit this as well. Fine. So it impairs platelet aggregation because it inhibits thromboxane A2. Now there are two COX-1 dependent mechanisms responsible for NSAID induced bleeding. First, if you inhibit COX-1, it leads to decreased thromboxane A2, so decreased platelet aggregation, leading to mucosal injury and bleeding. Mucosal injury and bleeding. Fine. Impaired platelet aggregation. Then another thing is it also inhibits prostaglandins. Decrease in the level of PGE2 and PGI2. PGI2, though I told you, it inhibits platelets. So what happens if PGI2 and PGE2 both are inhibited? You have first gastric hyperacidity, number one, and number two, you have impaired mucosal defense. Mucosal, you know, it is gastroprotective PGE2, right? The bicarbonate and the mucus layer which prevents the erosion. Otherwise our stomach would be जल के राख हो जाएगा पेट, इतना हाइड्रोक्लोरिक एसिड का pH हाई होता है, 1 to 2 होता है. So impaired mucosal defense. If this is done, there is mucosal injury and bleeding. So all these three lead to mucosal injury and bleeding. Now we come on to the options. CNS depression, gastrointestinal bleeding. Obviously we dealt with this. The answer is gastroenteritis, but I will discuss each and everything because those are clinical points. Now USMLE, the best part about USMLE and NEET and next exam will also be that they will be testing all subjects, multiple topics, multiple options. Hyperpnea, vertigo, orthostatic hypotension, sexual dysfunction and urinary bladder cancer. Now I'll be dealing with every option one by one. Number 1A, we told you depressants, right? CNS depression is commonly seen with, yes, excellent, very good. Benzodiazepines, because barbiturates are now out of vogue or out of use now. Because they potentiate the effect of GABA, a major inhibitory neurotransmitter on GABA A receptors. GABA and glycine are basically inhibitory neurotransmitters, and aspartate and glutamate are the excitatory neurotransmitters. There is a fine balance between GABA and glycine, which if maintained, it is good for us. Then choice C. Very high dose of aspirin can cause salicylism. This is characterized by, yes, very good, you know this, vertigo, chakkarana, tinnitus, ringing in the ears, hearing loss, and hyperpnea, because it stimulates respiratory drive. And why is respiratory drive stimulated? Obviously because of increased CO2. Very good, excellent. So it stimulates hyperpnea. Hyperpnea can also result in very important thing, which is respiratory alkalosis. Whereas systemic salicylate accumulation often leads to concurrent metabolic acidosis. Systemic aspirin accumulation can lead to concurrent metabolic. I have explained metabolic acidosis and respiratory alkalosis in my earlier videos. If you have any doubt, please feel free to ask. Then orthostatic hypotension can occur with the use of antihypertensive medications. I told you orthostatic or postural. When you are lying down and you suddenly stand up, there is peripheral pooling of blood in the lower extremities, which is known as orthostatic hypotension, sudden fall of BP. This can occur due to the use of other antihypertensive medications like nitrates, calcium channel blockers. Yeah, it can occur with this also. Nitrates, calcium channel blockers, and volume depletion can seen with loop and thiazide diuretics. Loop diuretics such as furosemide, bumetanide, torsemide, and thiazide diuretics, hydrochlorothiazide, chlorthalidone. Okay. But here we are using amlodipine. So with amlodipine, this chance is very less. Then sexual dysfunction is a common side effect of antidepressant, tricyclic antidepressants, selective serotonin reuptake inhibitors, and certain antihypertensives like thiazide diuretics, spironolactone. वो हसीना वो नीलम परी कर गई कैसी जादूगरी नींदे नाकों से छीन ली है दिल में बेचैनियां हैं भरी मैंने जाना हुआ आवारा किसने महीने अब किस किस को दिल में मेरे है दर्द डिस्को दर्द डिस्को दर्द डिस्को दिल में मेरे है दर्द डिस्को दर्द डिस्को दर्द डिस्को. वाई डिड आई मेंशन इट? क्योंकि अभी मेरे को याद आ गया एकदम से. डिजॉक्सिन, आइसोनियाजिड, स्पाइरोनोलैक्टोन, ketoconazole, yeah, cimetidine, which is H1 blocker, and OS omeprazole. No, गलती से बोल दिया omeprazole, estrogen. तो ये क्या करते हैं? These are responsible for man boobs. तो डिजॉक्साइरोनोलैक्टोन भी आप लोग यहीं पे याद कर लो. फिर सेक्सुअल डिस्फंक्शन और किसकी वजह से हो सकता है? ये तो सिर्फ मैन बूस्ट करने वाले ड्रग्स हैं. सेक्सुअल डिस्फंक्शन तो स्पाइरोनोलैक्टोन, थायजाइड्स, SSRIs, TCAs and clonidine. Clonidine, which is an alpha 2 agonist. Alpha 2, so it is GI coupled, जो ANS मैंने बता ही चुका हूँ, inhibits the vasomotor center in the brainstem. ठीक है, so decreases central sympathetic outflow, decreases central sympathetic outflow. And last but not the least, the choice F है, that is pioglitazone. Pioglitazone, which is a pioglitazone, rosiglitazone, these are thiazolidine diones. They increase insulin sensitivity. क्या करते हैं? Increase insulin sensitivity in patients with type 2 diabetes mellitus by binding to peroxisome proliferator activated receptor gamma. एक होता है अल्फा. अल्फा होता है वो एक लिपिड लोअरिंग ड्रग से बाइंड करता है. मुझे कमेंट सेक्शन में बताइए कौन सा. Long-term use of pioglitazone can be associated with urinary bladder cancer, carcinoma of the urinary bladder. Bye.